Hi, I'm Kathy B. with YourHealthUpdates.com, and today I'm with Dr. Matthew Rowe. Now, he's an upper cervical chiropractor, which is different than your traditional chiropractor. Let's find out how. Hello, Dr. Rowe.
Hello, Kathy. It's great to be here.
Thanks. Hey, listen, you do something different than the typical chiropractor in your field. Tell us about it.
Well, upper cervical chiropractic is a radically different approach to healthcare. What it is it focuses on the top two bones in the neck. These top two bones are different than anywhere else in the spine, and they're free-floating. They're held in place by muscles. We, as upper cervical chiropractors, we take a different look. We actually measure down to 1/4 of a degree exactly how far these bones have moved out of place. There's a small portion of our brain called the brainstem that sits between these top two bones. It comes down through the base of the skull, sits between the top two bones, and it becomes our spinal cord from there down. Now, our brainstem is like our little control system. It runs our body. If the messages from our brain to our body are interrupted, every cell, organ, and tissue can be affected. So the pancreas with insulin production, the heart, we might see erratic high blood pressure, heart rate, the muscles, the ligaments, even back up into the head, face, and the neck. So it's really a global effect.
Okay, so what it sounds like to me, if somebody has maybe a little bit of a disc out of place, it can affect the entire body system?
Well, actually, it's not the disc so much as it's the bones.
The bones, okay.
So if the bones, they shift, twist, turn, they can actually move in over 274 different ways.
Wow.
So it's very, very important. It's almost like a fingerprint. So everyone's different. And that's one of the important things that we as upper cervical chiropractors look at, is we want to make sure that we're actually addressing your physical misalignment.
Okay. Well, it sounds like to me then that if somebody has an issue with the body system, something that you can address. So maybe a little bit later we'll find out how. Thanks. And we're here again with Dr. Matthew Rowe, our upper cervical chiropractor. Now, I have to admit, I am one of the biggest chickens out there, and I have avoided going to a chiropractor because I really don't like the idea of being twisted and turned and hearing cracks. But Dr. Rowe tells me that this is a lot different, so we're going to let him prove it. So, hello there, Dr. Rowe.
Hey, there's nothing to be afraid of. Upper cervical chiropractic is the gentlest type of chiropractic you can experience. No twisting, turning, pulling, so you're in good hands.
Okay, good. All right, so show me what you do.
All right. So as a new patient coming to the office, first we would have gone through a thorough history consultation. We want to make sure that it is something that we can help with and that we can accept your case.
Okay.
Once we determine if it's something that we've seen fantastic results with, we do a couple different checks. This first one we're going to run with you today is called digital infrared paraspinal thermography.
Okay, and that sounds like there's heat.
Well, what it is it's infrared, and it's a big fancy word for nerve scan.
Okay.
We use this, we just run it up the neck. We call it the tickle test for the kids, because they don't like nerve scan.
Neither does this kid.
So we're just going to run the tickle test up the neck here, okay?
Does it really tickle?
You tell me. What we're going to do is we're just going to have you look down towards your knees.
And pray?
No praying needed. We're just going to run it up the neck here. All you're going to feel is a slight tickle. And we'll do it a couple times. Okay, great.
That's it?
That's it.
Oh, that was easy.
Not bad.
It didn't even hurt.
Good.
That's
Well,
nice.
Let me explain what we've got here, okay? We've got two barrels.
Okay.
The barrel on the left reads the skin temperature on the left side of the neck.
Okay.
The barrel on the right reads the right side of your neck. This is the left side, this is the right side. Now this is the difference between the two. Now the left should be equal to the right, and if it's not, it gives us a crooked line like we see with you here.
Okay.
Normal would be nice and straight in the center. And if we follow yours up, we ran this graph twice, and we can see how they're virtually identical, and they swing way out here to the right.
Okay.
Okay. Now this graph is very, very indicative of pressure on that brainstem area. If we look at you in a bar graph standpoint, it's a little bit easier to see. We see a couple different colors here. Now there's a green, which we see here. If you were green up and down, there's no pressure on that brainstem area, and there's not a lot that we as upper cervical doctors can do to help you.
Okay.
We've also got yellow, which is mild pressure, moderate, which is the orange, and red, which is severe. And unfortunately, Kathy, we do see that we do have some severe pressure here.
Okay.
So we have to determine as upper cervical chiropractors what is causing this pressure. Our primary goal is to get this pressure removed from that brainstem area so that the body can function the way it was designed to.
And that's something that I don't feel any pressure there. So could a lot of people maybe be walking around with problems and not be aware?
Absolutely. And this is one of the things that we educate on, is that the nervous system is very, very complex. Symptoms are always the last thing to present. If we constantly treat symptoms, then we'll never actually address the cause of the problem.
Okay.
By running these little scans, it doesn't surprise me to see the pressure because of some of the things we talked about earlier. But these scans are often very, very eye-opening for patients because they will not realize that how much pressure is there. And if we can get this cleared out, we can prevent these things from, these crises from happening in the future.
Okay. Well, it really was quite painful, painless. And I'm glad to find out that there is a little something that can be fixed. And maybe next time you can fix it for me and we'll see that procedure.